about the COVID-19 vaccine. We're going to hear from some experts today, but I wanted to introduce myself and the other CEOs from the chambers. I'm Allie Williams, President and CEO from the Greater Bethesda Chamber of Commerce. Jane?
The famous last words, you're on mute. Okay, and I'm Jane Rediker. I'm President of the Greater Silver Spring Chamber of Commerce, and I welcome everyone. And Marilyn?
Hi, good afternoon, everyone. Marilyn Balcom, President and CEO of the Gaithersburg-Germantown Chamber, and so nice to see everyone attending today. And thank you to our experts. This is a very important topic. Thank you.
Great, thanks everyone. And we're going to turn this over to Courtney DeLuca, who will handle the presentation for us today. She'll remove some of us from the screen, but we'll be back towards the end. If you have questions throughout, please put them into the Q&A box. We're going to be monitoring that, and we will address those questions towards the end of the presentation. So enjoy.
Hi, everybody. First want to introduce Dr. Matthew Mintz, who is our co-chair for our Healthcare and Wellness Committee, and he will be giving us an update on the vaccine situation. So I'll hand it over to you, Dr. Mintz.
Great, thank you very much. Very pleased to be here with all these wonderful chambers. I was asked to, before the meeting started, just to give a very quick update on the vaccine. So again, hopefully you can see my screen. Again, my name is Dr. Matthew Mintz. I'm an internal medicine and primary care physician. I have a concierge practice located in Bethesda. It's in the Wildwood Medical Center. And so for those of you familiar with the area, it's right across from Balducci's. And so I'll give you just a couple minutes of the vaccine overview. And what I want to first start with is where we are with the cases, because it's, I think, relevant to vaccines. So this is the graph that I look at pretty much on a daily basis, looking at the Montgomery County numbers. There's a link up above where you can get this graph too. And where you can see is that there's finally some good news, that the cases are coming down. We sort of peaked in late May, early June. And we did what we were supposed to do and flatten the curve, and we held to under 100 cases for quite a long time until about right around Thanksgiving time, where they kept going up and up and up and up and up. And finally, we're starting to see a downward turn. Whether or not that will stay is unclear. You've probably heard about variants of the virus. Hopefully social distancing and masking is helping, but I think we're starting to see the first signs of the vaccine, as well as maybe a little bit of a herd immunity. So some good news there. So I want to talk very quickly a little science. I promise there will not be a quiz at the end, but I think this will help explain a few things about the vaccine. So at the top left corner, there's a picture of the coronavirus, and those red things, spiky things, that's called the spike protein. And so the coronavirus, if you think about it, it looks like the sun. And if you remember from your basics, from your elementary school science, the thing around the sun is called the corona, and it's Latin for crown. And so it's sort of the crown of the virus. That's what the spike protein is. That's why we call it the coronavirus. And your typical vaccines, the way we make them is the way we make the typical vaccines is we inject a vaccine into someone, or either a cut up version of that vaccine or a weak vaccine, and to induce an immune response. And the problem with that is it takes a long time to make that vaccine. In the middle stripe there, you'll see the process of typically making an egg-based vaccine. They have to grow it, culture it in eggs and animals, and it takes a long time to make that vaccine, to develop it, and then to make it before you can test it. What's cool about these newer vaccines, they are mRNA vaccines. And so basically DNA is sort of the blueprint that we have for, our whole body. And so DNA is deoxyribonucleic acid. Again, I promise there won't be an exam. And the way that it takes that blueprint and makes proteins in the body is it translates it through something called messenger RNA or mRNA. And that goes to our ribosomes in our cells that make all our wonderful proteins. And the way the newer vaccines work is they're these mRNA vaccines. So they take the mRNA of the coronavirus's spike protein, put that into our bodies, we make spike proteins, and then our body develops an immune response to it. And that's how these newer vaccines work. And it's really helped in a number of ways. So to answer some very basic questions, I want to talk about some myths and facts. So myth number one, the vaccine isn't safe because it was rushed out. No, actually the vaccine is very safe. How did it get developed so quickly? So on the one end, because it's an mRNA vaccine and you don't have to grow it in eggs and cultures, you were able to start clinical trials right away. The other way we were able to shorten the time for vaccine is on the back end with all the sort of bureaucracy of getting things approved through the FDA. And so emergency authorization allowed it. So the way they actually, the testing part where you test it in humans is not changed at all. So the vaccine is very, very safe. Secondly, it changes your DNA. No, it's an mRNA vaccine. It doesn't get into your DNA. It can't change your DNA. Can give you COVID. No, it's not an attenuated strain. It's not like the flu vaccine either. It's an mRNA of the spike protein. You cannot get COVID from the vaccine. Now you'll have a reaction. I'll talk about it in a second, but you're not going to get COVID. Contains egg protein. It's not developed through eggs. So if you're allergic to eggs, you can, in fact, you can allergic to anything. You can take, there's almost no one that can't get the COVID vaccine. So it's very, very safe. Those people who have had severe allergic reactions should take it cautiously, but even they can get, the coronavirus vaccine. Causes severe side effects. It depends on what you mean by severe. The response rates are variable. Everyone's a little bit different. Some people do, especially after the second dose, can get some significant, feeling badly, but it's totally safe. It's better to feel bad for a day or two than die from COVID. So most people do just fine. The symptoms are mild, usually goes away in a few days. Some people, they need to take a day or two off of work because they feel really bad, but it's not going to make you that sick. I don't know where this infertility myth comes from, but it's just not true. Even pregnant women can and should be vaccinated. And then the last one is already had COVID, so I really don't need the vaccine. Currently, we don't know how much immunity having COVID protects you in the future and how long that lasts. So currently experts are recommending that even if you have COVID, you should get the vaccine. That might change, by the way, but for right now, that's the current recommendation. Very briefly about that, we have about 6 vaccines out there. The 2 main ones approved in the US are the Moderna and the Pfizer vaccines. Johnson & Johnson should be approved very quickly. Again, they're all mRNA based, very, very effective. Some subtle differences with storage and how many days. So I get a lot of the questions of, should I take which one should I get? And the answer is they're all very effective, even the Johnson & Johnson. And one last important thing to say about this is that while the US vaccine was about 75% effective, the efficacy, that measure was about getting sick, okay? While we don't want you to get sick, what we really care about is you going to the hospital or dying. That's what is different between this and the flu. So anything that prevents hospitalization and dying is going to be a good thing. And of all 6 of these vaccines, there's been over 75,000 people who have tested these vaccines all across the world. None of them have died or gone into the hospital. So even though the Johnson & Johnson vaccine is theoretically less effective, it's still very good. So the answer is get whatever vaccine you can. And what's nice about the Johnson & Johnson one is it's only one shot and it doesn't need to be stored in anything but a regular refrigerator. So we'll probably see more of that. But basically, very, very, very good news about the vaccine. It's safe, it's effective. Everyone should get it, and you should get whatever vaccine you should get. So finally, the last question I typically get is, how do I get the vaccine? And the problem is it's unfortunately still quite a mess. And there's a lot of different reasons for this. A lot of it has to do with the confusing rollout. So for example, the Montgomery County is still in phase 1B, whereas the state of Maryland is in phase 1C. So you have a discrepancy from the county and the state. There's not one central easy way where everyone lines up and you get emailed your vaccine appointment. It's sort of like a crapshoot, and it's very frustrating. I get calls every day from patients about not being able to get the vaccine. A lot of it's a combination of a confusing rollout plus a very, very, very limited supply. So the best thing to do to get vaccine is to go to one of the websites, either the Montgomery County website, which is listed there, or the Maryland website, and sign up for all the lists and go on every day. And for example, I think just today they just added Walgreens as a site for getting the vaccine, at least in Montgomery County. So that's good news. So hopefully there'll be more and more opportunities, but unfortunately, there's no easy answer. You basically have to go online. If you qualify and meet one of these criteria, go online every day, check out the websites. It's a frustrating process, but unfortunately, I don't have any other alternatives. The doctors don't have a special way to get you the vaccine. I wish I did, but we don't. So you just have to be patient and keep trying. So I can take questions at the end about that, but I was told a very quick overview about the vaccine in general before we talk about what I think is the main point of this and dealing with some of the HR issues that you have for your businesses. So thank you very much to all the chambers for having me. I'll stick around through the meeting. Happy to take any of your vaccine or COVID related questions.
Thank you, Dr. Mintz. Yes, for everyone who has a question about for Dr. Mintz's presentation, we will get to those at the end. So I would now like to introduce Michael Neary and Marc Engel from Lerch Early Brewer, and they will be discussing what employers should do about the COVID-19 vaccine. So I will hand it over to you guys and I will get.
All right. Well, thank you so much, Courtney, and thank you everybody for joining us. Marc and I have been studying and following the developments with the rollout of the vaccine and how the vaccine and desires to protect the workforce interrelate with a number of employment laws. And so we hopefully today will walk you through what laws you need to be thinking about, what the guidance from the federal government is, and talk through our thoughts on the best approach to this, and we'll give you a couple of options on how to think about this and to plan. And it's important to realize that for many of you, it's months down the road before this will really be something that will be out there enough that you could implement a mandatory policy to require the vaccine. But it's good to be thinking about it now and planning it now, because no matter what choice you want to make, whether you want to try to mandate your workforce to get the vaccine or whether you want to have a strong recommendation, you're going to need policies in place and protocols in place, which we'll talk about today. So I'm going to go through the legal analysis and talk about the guidance, and then I'm going to turn it over to Marc to talk about some takeaways and best practices and some insurance considerations that everybody should be considering. So first off, let's just talk about the background, where we are in this pandemic. And if you could advance the slide, that'd be great. We are still in the middle of a global pandemic, according to CDC, the World Health Organization, and all of these various bodies have determined that COVID-19 presents a significant risk of substantial harm. We all know that from reading the news and following what's going on in the world. But for employment lawyers like Marc and I, when we hear things such as significant risk of substantial harm, bells go off in our heads, because there is a doctrine under what's called the Americans with Disabilities Act, and it's called the direct threat doctrine. And that language that the CDC, Health and Human Services, the World Health Organization, all these entities are using coincides with the direct threat doctrine, which basically indicates if you have a substantial risk of harm to your work environment posed by someone with a traditional disability, that changes your obligations to accommodate that individual and or to make decisions based on that. For, as an example, if you had somebody who had perhaps a mental disability, and that individual in a normal course, you would be accommodating them, maybe making changes to your policies to ensure that that individual could do their job. Under the Americans with Disabilities Act, you would have that obligation. Well, if the individual's condition rose to the level where there was threats being made, erratic behavior, demonstrable indications that there was an actual threat to your work environment from that individual, well, your duty under the direct threat analysis to accommodate that individual falls away. And that, given the declarations from these entities that COVID-19 presents this substantial harm, that changes things in terms of the vaccine. Typically with a flu vaccine, the only employers that would do a mandatory policy would be hospitals or employers that worked with a critical care population that would be at great risk of adverse consequences from getting the flu. And that's because, if you go to the next slide, that's because of these laws that are in place. The Americans with Disabilities Act, mentioned that earlier, Title VII, which has a protection for religious beliefs. The GINA law, it's the Genetic Information Non-Discrimination Act, and there's some state and local laws. And so these laws really form the framework that you need to be thinking about as you consider vaccines for COVID-19. And it's similar that would apply for a flu vaccine. And that's why most employers don't have mandatory flu vaccine processes. But since we're now in a direct threat environment, these laws and how they relate to your workplaces give way a little bit to what it is you can do for your policies in terms of mandating or recommending a vaccine. So what the federal government did at the tail end of the last administration, the Equal Employment Opportunity Commission issued some guidance. And if you go to the next slide, what they did was they came out and they analyzed pretty much these areas of the law, the Americans with Disabilities Act, Title VII, and the GINA law. And the question they were considering was whether or not employers can mandate vaccines. Can an employer create a policy that says, if you want to work for us, you need to get the COVID-19 vaccine? And the executive summary is you can do it, but there was a big catch within the guidance that we'll get at in a minute. But the first hurdle that was identified in the guidance is the notion that we are still in a pandemic environment and there's an emergency declaration. So that relates to the Americans with Disabilities Act, as I mentioned earlier, with the direct threat analysis. So EEOC said you can do it. You can mandate it in this type of environment, which is important as you consider what you're going to do in your workplaces, because if the pandemic abates and the declarations of emergency relaxes, it's possible that the guidance could change. So one of the big takeaways from this issue, in my point of view and perspective, is if you're going to go with a mandatory vaccine protocol, you've got to be monitoring it over time. What's going on in the world? What's going on locally? You want to have a sense of, has the guidance changed? So you want to be monitoring the news for any big changes in that. Marc and I contribute to an employment blog. It's available on our website at lerchearly.com, where we try to write on these types of issues. But it's not something you could just set and forget. If you went with a mandatory vaccine program, we'll talk about that in a minute, how you would do that. You can't just put it in a drawer and forget about it. You got to stay on top of these things and monitor it along the way. And so the EEOC said, fine, you can do it, but there's certain categories of employees that you would need to accommodate if you are going to have a mandatory program. So if for your work environment, you say, we're going to have a mandatory program, EEOC says that's fine, but you need to have clear protocols in place where individuals with medical disabilities or sincerely held religious beliefs can request an accommodation from your mandatory program. And that's because there is a duty to accommodate under the Americans with Disabilities Act those with medical conditions. And that's same if you've got somebody whose job requires them to lift heavy things. If they hurt their back, you would need to accommodate and work with that individual to see if you can modify their responsibilities for a period of time in order to allow them to continue to do the job. So if you had somebody who came to you and said, look, I can't get the vaccine because of XYZ condition, you would have to interact with that individual and provide an accommodation to your program, your mandatory program. It wouldn't necessarily be, okay, you don't have to get it, come on into work. It could be something short of that. Okay, you don't have to get it, but we'd like you to work from home, something of that nature. But the key is you got to engage in an interactive process with that individual to figure out if you can accommodate them. Similarly, the guidance says that under Title VII of the Civil Rights Act, which is the main federal law that talks about anti-discrimination, you can't discriminate against someone because of their race or gender or a host of other reasons. One of them is your religious beliefs. And under that law, the Equal Employment Opportunity Commission is saying, if somebody has a sincerely held religious belief that says they will not get the COVID-19 vaccine, you have to accommodate them. And this is a big area to watch. As you think about what may change as the administration changed, the EEOC has issued, it's just guidance. It didn't go through Congress. It's basically a recommendation. It's persuasive if there's ever a fight about it and you go to court, but it's not binding. It could be easily changed. One administration can, you've seen it all over the news, policies are changing every day. One area to watch is this religious accommodation angle, because I don't know if you recall, but a couple of years ago, there was a story out of New York where there was a measles outbreak, and there was a group of Orthodox Jewish community that did not have the vaccine or the immunization for the measles. And there was a New York state law that was passed that did not have a religious accommodation to it, that required people to get the immunization. And individuals challenged it, and they ultimately won in the court, is saying that there didn't have to be an accommodation for religious beliefs under the law, under the Constitution, and under the federal laws. It's not binding down here, but it's just something to consider, because it may be that this guidance is ultimately updated, and the new administration takes the position that you don't have to accommodate for religious beliefs. But the current law is you do. So if you're going to go with a mandatory program, you need to make sure that you have accommodation processes in place for medical and religious beliefs. Now, when we enter into a different phase of this vaccine program, where it's generally available to the public and it's available for employers to obtain and provide to their employees. Some employers already have done that. If you are in a hospital, you're probably administering the vaccine to your employees. Well, the EEOC guidance highlighted a potential problem if you have a mandatory program. And that arises under the Genetic Information Non-Discrimination Act. You typically can't be asking about someone's genetic history as a result of this law, this federal law. An employer can't be asking about it. And the protocol that you likely have to ask, the questions you have to ask as you're screening someone to administer the COVID-19 vaccine, probably implicates the Genetic Information Non-Discrimination Act. And so the EEOC came up with this workaround where they basically said, look, you can do it. You can have a mandatory program if you have your accommodations, if you recognize those accommodations. But if you administer it yourself, you could run afoul of GINA because you'll be asking these questions. And so they basically recommended that you outsource it. And right now, that's pretty much the only way to go. So if you instituted a mandatory program tomorrow, you've got to outsource it because the vaccine's not readily available and you're not going to be administering anything. You're going to be requiring your employees to get a shot if they can get it. And as it becomes generally available, and you have a mandatory program, the federal government is basically saying, to avoid violating GINA, be sure to outsource it, so you don't have to worry about that. Go to link up with Walgreens or do something else, where similar to a flu program where you have an outside group come in. You don't want to be administering it yourself. And as these issues develop, this guidance could change. And more importantly, new laws could come on the books, right? The federal government could change the law and require the vaccine, make it mandatory for certain industries. State governments, local governments could do the same. I could see scenarios where certain, particularly nursing homes, things of that nature, they could make it mandatory that you get this vaccine, in which case the entire legal landscape would change. So you want to be monitoring these things as they develop. We'll certainly be writing about it and trying to keep everybody informed as best we can through our blog and otherwise on developments. So if you go to the next slide, we'll start talking about your two options. We've got pretty much you could approach this one of two ways as an employer. You could have a mandatory policy, or you could have a strong recommendation. If you went with a mandatory program, you might want to do that because it becomes the standard in your industry. If it becomes the standard in your industry and you're not doing it, if someone gets sick under your care, or if one of your employees gets sick under your care, or under you on the clock, that could be a problem, because there could have been a duty that arises based just on the nature of your line of work. So you want to be thinking about it that way, or you just do it because you want to be a good citizen of the world, and you think that it's your duty, or you need to play a part in getting us there to that herd immunity. So if you go with this way and you do the mandatory program, you want to have a written policy. You want to have that policy's got to have an easily understood language, the pathway somebody would follow if they wanted a accommodation for a medical or religious reason. You want to link up with a group that you can outsource it to, or you can just institute your policy and tell your workforce, to get the vaccine elsewhere. I would strongly recommend not instituting a mandatory policy until we hit the point in the vaccine program where it's generally available to the population, because how would your workforce even get the vaccine if it's not generally available? So this, again, is probably months down the road, but if you go that route, mandatory program, you would have a written policy, easily understood accommodation protocols and forms. Fill out this form if you want an accommodation, turn it into this person. And if you get one of those accommodation requests, you have a duty to move quickly. You can't sit on something like that. And effectively what they're asking for is, I understand you have a written policy that requires me to get the vaccine to work here, but because of this reason, this medical reason or this religious reason, I don't want to get the vaccine. And then you would have to analyze that and figure out, okay, is this something we can accommodate? Or is the nature of our job or our work something where we can't give an accommodation to this? It might happen that way if there is a law that's passed that says in your industry, if you want to work in it, you got to get the vaccine, such as a nursing home or something like that. If those laws start happening, that could change how you approach an accommodation request. Or it could be this person can work from home. They can do their job from home. Maybe we'll just have them work from home. Fine, you don't have to get vaccinated, but work from home. It could be that they do a type of job that can't be done remotely, and then can it be done safely without the vaccine? Well, if you've been open for business since June, with masking and social distancing and all that, all those challenging things, and you've done it safely, maybe you could continue that for this individual. And it's got to be, you can't just have a blanket accommodation pathway. So you just need to take it one request at a time. If you do have a mandatory program, if you go to the next slide, please, you really need to be uniformly enforcing that policy. And you really need to understand that what you're saying is if someone doesn't get it and you can't figure out an accommodation, you're going to let them go. You're going to fire them. And so I just want you to think about, this scenario. Your best employee walks into your office the day after you roll out your mandatory policy and basically says, I'm not getting it. You guys are crazy. That was rushed. I've heard this. My brother-in-law had a friend who passed away right after they got the vaccine, whatever it is. I don't have a medical condition. I don't even believe in religion, but I'm not getting this vaccine. If you really have a mandatory program, you're going to have to fire that person if you can't find a way to accommodate them by letting them work from home or something like that. And I say that because if you then have your average employee walk in with the same reason, maybe it's a little different, maybe it's a little even quirkier than that, and you're, fire them, but you left your A+ employee stay. Now you're setting yourself up for a potential discrimination claim because the average employee that you let go might think it was because of an unlawful reason. Maybe it had something to do with I'm a woman or I'm a different color than that A+ employee. So do give thought to that dilemma. Maybe it's not even your A+ employee. Maybe it's your biggest revenue generator. But think about that dilemma as you consider whether a mandatory program is right for your business. The alternative way would be a policy adopting a strong recommendation to get the vaccine. And if you could go to the next slide on this one. Similarly, you would want a written policy that sets forth the business reason why you think it's important to get the vaccine. Maybe you could do some education through your policy for your workforce, and strongly encourage individuals to get the vaccine. We've seen in the news instances where some larger businesses have been publicized as offering incentives to get the vaccine. Time off, we'll pay you 3 hours when you go get the vaccine, or even just bonuses to get the vaccine. There's some interesting legal issues just on a straight up bonus to get the vaccine, but businesses are giving it a try. I know a group of businesses just this week, I think, asked the Equal Employment Opportunity Commission to weigh in on whether you could just straight up give a bonus for somebody to get the vaccine. Potential legal issues that could arise there are, does that discriminatorily impact those with medical conditions who can't get the vaccine because they're not eligible for that bonus? We'll see what the EEOC has to say about that. But incentive programs also used to implicate this body of regulations that came out about health incentive programs and whether or not that was violative of the Americans with Disabilities Act. About 5 years ago, that became all the rage, where employers were offering various incentives to do, join a gym, walk 10 miles a week or things of that nature. And those came under attack from individuals and interest groups. And so the Equal Employment Opportunity Commission instituted a bunch of regulations on that. And ultimately those regulations were pulled back. But there was a host of issues that were raised, and those issues would come up as well if you're trying to do an incentive program. So I would recommend doing, taking care if you're going to start throwing money around or employment benefits around to encourage the vaccine. Just think it through, talk to your advisors or your folks in your industry and try to dig a little deeper on the legal issues there. But in any event, you would have your policy, you'd talk about how you're recommending it. The benefit of doing it that way, if you just do a recommendation, is you're not putting your business in the chain of liability. So in the small chance of an adverse reaction to the vaccine, if you're just recommending it, no, you didn't force anybody to do it to keep their job, you're really removing yourself from the chain of liability if claims are filed thereafter. You don't have to worry about the accommodation forms. You don't have to worry about, figuring out, does this person really believe in this particular religion? Or is this just a convenient way to avoid the vaccine? You don't have to scrutinize medical records to figure out, do they really have a disability that prevents them from getting the vaccine? You don't have to do any of that because there's nothing to accommodate, because your policy is just a strong recommendation. You also can just set it and forget it. If you just have a recommendation. I mentioned earlier about having to monitor, okay, are we still in a pandemic environment? Are we still in a state of an emergency? What are the latest numbers? They change every day. You don't have to really worry about that because you're not having a policy forcing anybody to do anything. And so there's some benefit there for sure. And, you know, the final point on the recommended policy is, I touched on it based on your industry, right? Are you creating liability by not mandating it? And that's going to be a function of what the standard is in your industry. It's going to be a function of what the standard of, you know, the reasonable standard is nationally, right? If all businesses are mandating it and you're not, have they then, these other businesses set what's, you know, the reasonable care standard? Would then, if you're not doing it and someone gets sick, are you liable for that? I would tend to think that would take some regulations for your industry to create a regulatory standard that would require it, or a lot of advancement in where we are currently. I think one big law firm just did a study of businesses and what their plans were for the vaccine and whether they were going to mandate the vaccine. And I think only like 11% were considering mandatory programs. So I don't think we're in anywhere close to an environment where you would be liable for not mandating it, absent a change in circumstances from a business perspective or a change in a regulatory requirement. You know, if a government were to come in and say you needed the vaccine in order to work in that area. So I think where I come down, and I think Marc does as well, is you know, just as a general rule, the mandatory program is probably not the best move at this point. I mean, particularly at this point, because the vaccine is not generally available, but even when it does become generally available, it's probably not the best unless your industry dictates it, right? Unless there's some part of your business that puts you at, you know, you're swimming in the pool with a high risk population. So the nursing homes or in-home care, things of that nature. Now you're in an environment where you're interacting a lot with a population that is at high risk of a bad outcome. And so outside of those industries, you know, I think a recommended policy, doing whatever you can to encourage your workforce to get vaccinated is really the way to go. You know, I think what the latest guidance is, if you go to the next slide, is that we're nowhere close to changing kind of what the new normal is, whether we get vaccines out there, or if you mandate it or you recommend it or your workforce is vaccinated. The message that we're seeing from public health officials is still the same. You need to continue to social distance, mask up in indoor settings, you know, hand washing, all that stuff that came out at the beginning of the pandemic. The public health officials are suggesting that's going to continue for quite some time. Hopefully there's a light at the end of the tunnel and we hit herd immunity and the numbers collapse and the public health guidance changes. But in the interim, no matter which way you go in your policy, you still need to be following this new normal. You know, doing enhanced cleaning, air filtration systems, continuing to work with telework flexibility, things of that nature, because it's, you know, we're not going to be anywhere close to the public health officials lifting those things soon. So stay on top of that, give some thought to the issues I discussed. And I'm going to turn it over to Marc now to talk about some insurance issues and some big takeaways for how to think about these issues as you approach them.
Okay. Thank you, Mike. It was a great overview and summary of really a cloudy and a challenging area for sure. As Mike indicated, I'm going to touch on a little bit of what I think is the new normal, also some insurance issues and some takeaways. I'm going to loop back a little bit to talk about a few other points I think that were part and parcel of Mike's discussion. Invite him to chime in, obviously. But I think I want to preface some of my comments. You know, Mike's assessment and summary of the vaccine issue and where do employers go with that, to me, it becomes another bullet point in the new normal. Okay, we've got our series of best practices and things that we need to be thinking about during COVID, and certainly monitoring the vaccine issue and being in a position to make an informed decision based upon the best of information available, information from your industry, information from health professionals, information from the standard for folks who are doing what you do is going to be a critical piece of this going forward. So it very much becomes, in my view, sort of part of the new normal. Certainly want to commend Dr. Mintz on his excellent presentation. His materials, I'm sure, were very enlightening for all of us. But one thing I want to emphasize as well is because this is a daunting area for companies and employers of all kinds, for-profit, not-for-profit, large, medium, small. It's a very, very challenging area. It's a very challenging area for Mike and myself and everybody who deals with these issues on the employment side of things on a more regular basis. And I can't emphasize enough the premium on education. In terms of the vaccine issue, there are certainly a lot of cultural views about vaccines, both nationally, internationally, which we've all heard about to some degree. People have concerns, very justified concerns, fears, anxiety about the vaccination, and obviously the virus on a broader level. Dr. Mintz's summary and presentation is quite frankly something that a lot of folks may not be hearing or may not fully appreciate. So I would encourage you that when there are these opportunities to educate employees, provide them with programming, resources that are publicly available, that are relied upon, that can be a very, very healthy thing. So the new normal includes this discussion and this analysis of whether to require the vaccine or whether to strongly encourage it. I think where Mike and I come out, he's right. We're largely in the place now, for all the reasons Mike mentioned, of strongly encouraging that. Having said that, if you're in an industry dealing with a vulnerable population and the vaccine is available, it's a bit of a sliding scale, and that might tend towards mandating it. But again, these are decisions that need to be made by your executive team, and again, with thoughtful analysis. And Mike's 100% spot on in terms of the importance of looking at these issues now, even though the vaccine may not be as widely available as it will be in the next few months, because that issue is going to be upon us before we know it. So the idea is to plan now, get that information from reliable, trusted sources, from chambers of commerce, from trade associations, professional associations, the CDC, and recognized authorities that are shedding light on this important topic. The insurance issue is a really important one, if you'll turn to the next slide, which crops up in a number of different ways. And I'll touch on the two that appear on the slide, but also some broader insurance issues associated with COVID. Mike asked the very pivotal question, okay, it's one thing to make this decision sitting, doing it on a Zoom call or a virtual call, as we're doing these days, about whether to encourage the vaccine or to require it. It's quite another to deal with the outcome of that decision. And that begs the question of insurance. Is there insurance if you mandate the vaccine and are sued for it because there's a bad vaccine outcome? On the other hand, if you don't mandate it and you're dealing with, say, vulnerable population, is there a potential claim for negligence for not mandating? So a little bit of darned if you do and darned if you don't. But I think the takeaway here from the insurance piece of this is to explore with your insurance agent, your insurance broker, do you have insurance coverage, okay, for these types of claims, okay? Some of the policies may not specifically address the issue of a vaccine, okay? There may not be a new endorsement out there that addresses this issue. It may fall within some of the general principles of your existing insurance coverages under a general liability policy potentially, or under D&O policy, under an employment practices policy. But whatever the case and wherever the source of the coverage, the broader question and the important point is to sit down with your agent or meet with your agent these days or your broker and ask that important question, okay? Does the entity, an organization, have coverage? And to the individuals who may be involved in making that decision and administering that decision, have coverage, okay? Very important point to follow up on. The COVID issue in general raises the issue, and Mike and I have been dealing with this in a couple of different contexts of, when there is exposure to COVID or allegedly exposure to COVID in the workplace, and does that fall within the workers' compensation laws? And is it possible for employers to get sued for outside of the workers' compensation framework? So let me step back and pull the lens back for a second and provide a little bit of information about workers' comp. Workers' compensation is generally designed to address work-related injuries, slip and fall, okay? Somebody spills some water and somebody slips in the office. Okay, a traditional workers' comp type claim. Okay, we've seen all those. Somebody trips on the steps that you're responsible for cleaning and it's snowing outside, a workers' comp claim. The COVID issues get to be more challenging and problematic for a variety of reasons, not the least of which is trying to prove causality. Where did somebody contract COVID? Was it at the workplace? Okay, was it not at the workplace and they brought it into the workplace? Who was the first person that contracted it, and so forth and so on. So these are all very, very interesting issues. But from an insurance standpoint, again, you're going to want to visit this with your insurance agent and broker. Do I have insurance under my existing workers' comp coverage for this type of claim, right? Both of those claims are made by the employee, which is the traditional workers' comp. But there's a second part to many workers' comp policies known as employer's liability, okay, which can cover third-party claims. Okay, so heaven forbid somebody, passes away, or there's a bad outcome with the COVID, and a spouse or somebody in a family makes a claim. Is there coverage for that? Okay. More broadly, is there coverage if somebody says, as I just mentioned with the vaccination, you should not have required us to get the vaccine, or you should have required us to get the vaccine. Similarly, is there coverage under sort of a negligence theory that you didn't provide enough PPP? Okay, you required us to come into the office, you didn't let us work remotely, we came into the office and you didn't have enough PPP, you hadn't cleaned the office well enough, you hadn't used the right sanitizers, and therefore I contracted COVID. Okay, so again, the question would be, is there insurance for that circumstance? Okay, great questions to ask of your insurance agents and your insurance brokers. And from what I'm hearing, and I gather Mike to the same degree, it's a fluid area, as you might suspect, in the insurance industry, just like the rest of us are trying to grapple with this new reality and this new normal. And so it's important to find out if you do have coverage, obviously, but secondly, if you don't, is there a type of endorsement or an enhancement to an existing coverage that you could acquire to address these circumstances? Okay, moving on to the takeaways, if we could move to the next slide. Mike touched on a number of these, and I want to try to put it in, hopefully, some digestible takeaways in terms of an action plan. Okay, so we talked about one, looking into the insurance. Put a star next to that one. Really important, not just for the vaccine piece of this, but for the other aspects of this that I just mentioned. And also with respect to claims that are brought by employees who are working remotely. Do I have the same coverages for the employee who has a slip and fall at home as I would have in the office if they were here? Okay, so insurance is bullet point number one. Bullet point number two would be certainly continuing to monitor the guidance from the CDC and the government, state, and local authorities. Okay, you need to do that regularly. As Mike mentioned, we're writing about those issues. We're trying to keep our clients and all of our friends in the community aware of these developments, but really important to institutionally, and as part of your organization, make it a point to check out the latest from the CDC. Pop onto our website and see what's being written about these issues. Keep yourself informed, not only on a broader level, okay, but also within a state and local level, and also within your specific industry. The standards that may pertain for office building employers may not be identical to the ones that are required for school systems. So keep abreast of those. That's bullet point number two. Number three would be, do you have a system in place? Do you have a remote work policy? Okay. Do you have something committed to writing where everyone understands what the rules of the road are for folks who are working remotely and folks who are coming into the office. All right, again, if you've done that some months ago, probably a good idea to dust that off and see if it needs to get tweaked in light of the fact that increasingly folks are starting to return to the office. In that same regard, a fourth bullet point would be, do we have some sort of attestation or policy in place for when people come to the office, okay, for ensuring as best we can that they don't have COVID symptoms and have not, don't have COVID, don't have symptoms and haven't been in close contact with somebody who does. Our firm, for example, has an attestation form that all of us are required who come to the office every single day. We get a prompt. It's about 2/3 of a page that asks us to go through about 7 questions where we need to represent to the firm that we haven't been in close contact and we don't have the symptoms, okay? And it's the way of baking into our firm and our organization accountability for ensuring to the best degree that we can that we're not going to be endangering others, okay? Fifth would be, as Mike mentioned, adopt a vaccine policy, particularly if you're going to be mandating one, all right? Extremely important. Again, and at the risk of sounding patronizing, you're going to want to work with your legal advisors. This isn't an infomercial, but your legal advisors on that. Be really careful about just borrowing something from somebody who you know through the chamber who drafted a policy that's in a completely different industry, different size organization, and so forth, because it may or may not be applicable. Number one, it may or may not be legal, and B, it may not be applicable to your particular industry. Item number 6, training managers. And I'm going to harp on this because I always do, but there's probably never been in all my years a greater importance for training and working with managers regularly on COVID-related issues, include obviously the vaccine-related issues, which we're going to be dealing with soon enough, but more broadly on the whole range of, how do I manage, remote employees, right? What do I do if somebody calls in sick? What if someone who's tested positive for COVID wants to return to the office and they call a manager? How does that manager handle that? The inside baseball from my experience, and I think from Mike's, is you have a lot of particularly newer managers, and sometimes not so new, who are reluctant for one reason or another to ask questions internally and go to senior management, go to the HR professionals, go to the healthcare professionals to try to get information to make these decisions, because human nature being what it is, they don't want to seem foolish. They don't want to seem uninformed, and they don't want to seem incompetent in terms of making these types of decisions. And that's a prescription for a real problem, because particularly in the COVID world, where communication is so critically important. Another takeaway, if we can turn the slide and continue, is sort of who are your gatekeepers, okay? I'm a huge believer in trying to, in general, funneling questions that you get from employees about employment-related issues. It's great to train your staff, great to train the managers, hugely important, right? But, in terms of these sensitive issues about how does our new vaccine policy work, right? Are we going to actually encourage it? Are we going to provide an incentive? Are we going to mandate it? Again, I think as a best practice, generally, having those questions funneled to a knowledgeable individual, your HR managers, the quintessential individual to handle those. But if you don't have a designated person, somebody who's wearing 27 hats, it's the chief operating officer, chief executive officer. But the larger point is to be consistent in the messaging and the communication of these important issues, okay? So that you don't have a lack of communication. You don't have people not knowing what may have been said to employees. For example, okay, somebody wants to return to work who's had close contact with somebody who's tested positive for COVID. They tell his or her manager, right? Very practical issue. And that manager doesn't communicate that to HR, doesn't communicate that to senior management. And lo and behold, that person comes back into the office to pick up some files. And we don't have a self-attestation form or any way of knowing that that person even came into the office. Okay. And then all of a sudden there's somebody contracts COVID in the office and we're scrambling to do contact tracing. Okay. We're scrambling to figure out who may have been in and when. Okay. Well, a lot of that could have been relieved had there been a system in place. Consider an expert. I mean, I really took to heart Dr. Mintz's comments were excellent, but you know, for your industry, for the type of business that you're in, the type of service that you provide, you know, there are consultants out there that can evaluate the vaccine issues or assist in analyzing those issues, and more broadly assist with COVID-related issues. Okay. At the end of the day, when it comes to liability, or when it comes to more broadly kind of easing comfort and anxiety that employees have, the more that you can communicate to staff that you are on top of these issues, that you're working with consultants as appropriate, okay, to get the relevant information, the more that you're going to, all things being equal, you're going to encourage employees to feel confident in the decisions that you're making, and confident in the recommendations that you're providing, because they will be based upon fact and information. Another related point is, you know, if you are going to be adopting the vaccination, making it required or encouraged, what are you going to do about paying for it? What are you going to do when folks need time off to go ahead and get that vaccine? Okay, what are you going to do if they need to take leave because of, you know, they've had some side effects and they're not feeling well for a day or two? Okay, are they going to have to tap into their sick and safe leave? Is that going to be counted, quote unquote, counted against them? Okay, so again, that is not an exhaustive list, and we certainly want to leave some time for questions. But I think the larger takeaways here are, you know, this is going to require some massaging and updating of existing documents and policies. Okay, one thing that we really haven't talked about too much is that whatever decision gets made with respect to vaccines, okay, you need to be thinking about how, if at all, that's going to be impacting your leave policies. Okay, in Montgomery County, you have a sick and safe leave policy. Some of you may have PTO policies above that. Others may have leave that you're providing as an extension under the Families First Coronavirus Response Act. Okay, so again, the takeaway there is, if we're going to require it, if we're going to encourage it, if we're going to be supporting the vaccines, what are we doing with the related issues associated with that vaccine? So let me stop there, turn it back to Mike and see if there's anything that he'd like to add, and then I guess we can open it up for some questions.
No, thanks, Mark. I think we covered it. I think a number of questions come in. Allie, did you want to walk us through, or you want me to try to go through some of these?
Here we go. 1 second. Let me just bring up. All right. Some of these are, I think this first one I see. Do you think this vaccine will be an annual requirement after this year? Will the supply be less stressful in the future? I think the beginning ones are for Dr. Mintz.
All right, so I can take that really quickly. Again, we don't really know. That's part of the issue. We know what it is. For the question really is it going to be like the flu shot where you're supposed to get every year, or is it more like, you know, the tetanus shot where you can get every 10 years? We just don't know. My guess is it probably, at least initially, will be an annual vaccine, but until we get everyone vaccinated who can and wants to be vaccinated, that's not even an issue. So we don't know yet, but you know, I wouldn't be surprised if it becomes like the flu shot. You get your flu shot, you get your COVID shot, you're good to go. As far as the other sort of first questions about getting it, again, the website I put in my presentation, there's the Maryland website, which is covidvax.maryland.gov. That's the Maryland site. And then Montgomery County, if you just go to the Montgomery County website, which is montgomerycountymd.gov, there's COVID links on that, and that's where all the main sites are. And unfortunately, there's no way to get ahead. You can't pay for it. Your doctor can't get you a first in line. There's no way. You know, you have to meet the certain criteria that are of the county or the state at that time. Who meets those specific criteria, 1A, 2C, that's all on both of those websites that I just gave you.
There is one, if travel is required for your job, do you get priority for the vaccine?
I could just, the priority for the vaccine has already been determined by the state and the county. And to my knowledge, travel is not on that list. It's you're either sick or essential or of a certain age. Those are sort of the three baskets. There's not like, I don't think there's a travel one. I would have to double check that. But that's typically, it's you're either essential or not essential. But eventually everyone's, at some point, hopefully soon, it'll be open for everyone. So anyone will be able to get it. But traveling doesn't necessarily make you, it's really what your job is, not whether you travel for it. You can be a celebrity and travel to do celebrity things. That doesn't get you higher grade, if you will.
Okay, and this one is for Mike or Marc. Does size of business, number of employees make a difference in how these laws are applied, or do they just apply to all W-2 employees?
Well, from my perspective, so if you're under 15 employees on the federal level, a lot of these federal laws I talked about aren't going to apply. But there's state and local counterparts. And so the principles are fairly similar. And the details are a bit different. But I think employers of all sizes should be considering these matters. The nuance might be different, and if push came to shove, if a claim was filed, there might be defenses, but a lot of these issues should guide you in what you do, no matter how many employees you have.
Yeah, I would agree with that. I think that's a good way to proceed and a good way to kind of think about these issues.
Okay, and then next, if an employer does not require vaccinations, how does the employer deal with an employee who does not want to come to work in an office because they do not feel safe if all employees are not vaccinated, especially if the employee cannot perform their job remotely?
Yeah, it's a really good question, and I think it kind of implicates what Mike and I have been talking about for the past hour, which is that, you know, the whole dilemma about whether you should require the vaccine or encourage it. You know, you have the two general exceptions to requiring the vaccine that Mike alluded to earlier, which is the disability and the religious accommodation. You know, we have seen this issue where employees are understandably reticent to come to the office for a variety of reasons. The fact that people may not be vaccinated is going to be added to that list. What I've tried to recommend to clients do, one, is to try to really understand and have the client understand what the genesis of the concern is. Okay, sometimes additional information. We have a client who, for example, you know, had a doctor put a presentation, making it available for all employees, and a Q&A that followed because there was some discomfort about folks getting the vaccine, and I understand that was extremely helpful in diffusing a lot of the anxiety, for many of the reasons that Dr. Mintz alluded to earlier. So certainly trying to understand what the nature of the concern is. Number one, okay. If that individual has a health issue, then certainly you're sort of into the accommodation analysis. Is there an accommodation that can occur, that can take place? Can that individual continue to work remotely, or at least perform some of those duties remotely, at least for the time being? Other things that can be done that we've tried, that clients have considered, are, you know, scheduling. If people are reticent to travel because they have to use public transportation, you know, sometimes scheduling changes have been effective. So, you know, in terms of when people have to come into the office. At the end of the day, if the job, where the rubber sort of hits the road, so to speak, if the job cannot be performed remotely, okay, and you're not in an accommodation situation, then you're sort of getting up to the issue. You're getting close to the decision of whether, you know, you can continue to employ that individual going forward. Some clients, you know, our general advice is to try to make termination a measure of last resort. Sometimes individuals take leave without pay for a while. So there's a variety of strategies that you can use, but those are some of my thoughts. Mike may have some additional ones.
Yeah, I mean, I've seen that a lot over the last couple months, just general anxiety, not coming back. And it's important to recognize that anxiety could be a diagnosable disability. So, or you're treating them as disabled. So on the surface, it might just be this person just, no medical issues, they're just scared. They don't want to come out. But it could be it could present itself as a medical accommodation issue, even if the employee's not raising particular buzzwords. So just be mindful of that. But as Marc said, if the rubber hits the road and the job can't be done remotely and they won't come back and it's not a diagnosable or treatable medical condition, then ultimately you can move on. But you want to try to be empathetic and see if you can come up with a workaround, because that's the type of stuff that also could end up in the news or have adverse social media implications. So just try to be empathetic in these situations as best you can.
I also want to add, with the vaccine, there's risk to you and there's risk to others. And these vaccines are so good. Again, over 75,000 people have had some vaccine. No one's been hospitalized or died. So even if your policy, and again, no HR expert, let me just be very clear on that. Even if your policy is what you've suggested, is to say maybe suggest it but not require it, if your employee is able to get the vaccine, they should be very safe to return to work, regardless of whether the other employees. It's the other employees that have not been vaccinated that are at risk, not the employee that's been vaccinated who's really at risk.
Okay. What if you don't require the vaccine and then someone on your staff gets COVID and infects someone else or a client?
So I think that goes to the point of, where are we in terms of the industry standard in your particular industry? Is it common, or all the businesses doing it? Is there any regulatory requirement that you get the vaccine? A regulatory requirement can set the standard of care. So if it was required and you didn't do it, for your business, that's negligence in and of itself. But routine practice in the industry that you're in could also set that standard. Right now, we're not there. So whether or not you could be liable for not mandating it is probably unlikely. But as time goes on and it becomes more readily available and it's more industries and more businesses in your industry are doing it, it could be setting the benchmark to make it kind of a standard of care where you would require it. But I don't think we're there yet. I don't know if Marc has any different thoughts.
I think you've summarized it very well, Mike. I would echo what you had to say.
Can I just chime in? There are state and federal legislators are looking at this liability issue. And so it may be that sometime in the near future, we'll get some clarification from either the state or the federal government about this liability issue of contracting COVID in the workplace.
Okay, there's just a couple more. What about events in the future? If you have an annual fundraising event that normally has hundreds of attendees, what's within your rights in terms of asking if attendees have been vaccinated or requiring proof of vaccination to attend?
Yeah, interesting question. I think that, subject to the issues about, religious reasons and potentially disabilities, I think that employers are going to probably have a pretty broad bandwidth to require that down the road when the vaccine becomes more generally available, would be my sense. And one of the reasons I say that by way of analogy, for example, in our office, and I suspect in many other offices, and we see it in different places where you have to get a temperature check, right, before you can go into certain retail stores. In our offices, in rare occasions when we have folks who actually come into the office for an important client meeting, we have them complete an attestation as well, okay, because we want to ensure the safety of our colleagues. So I think subject to, being consistent in that requirement, subject to the limitations and exceptions about, accommodating certain situations. My sense is there's going to be probably pretty broad bandwidth for doing that. As to Marilyn's point, it's a great point. On the liability issues, there may be things coming down the pike that are going to protect employers and organizations in those circumstances who have those events. Mike, I'm not sure if there's anything you'd want to add to that.
Yeah, I mean, I think that's, just echo that. I also think that you got to be mindful that in the months to come, things could be different and the need for asking that question might not be there. So you just got to be flexible and take a flexible approach to it. But if we hopefully hit herd immunity in a few months and the numbers drop and the emergency declarations abate, asking that question could seem really out of place at a time in the future we all hope to get to pretty quick.
Okay, and it looks like there's one more. This is for Dr. Mintz. What about the stories we've seen recently of people who have received both doses still getting COVID? Does that raise concerns about the vaccine?
So again, to be clear, the two vaccines that are available in the United States are the Pfizer vaccine, the Mrna vaccine. They're 95% effective in preventing hospitalizations, 95% effective in getting sick, and 100% so far in preventing death and hospitalizations. The J&J vaccine a little bit less, but that means 5% of people will get sick. So it's sort of like the flu vaccine. I mean, the flu vaccine is much less effective. Depending on the year, it's only 60–70% effective. Again, the goal is not necessarily to prevent the flu. It's to prevent you from getting seriously ill or harmed or dying from the flu. It's the same thing. So yes, we don't want people to get COVID symptoms if they have the vaccine, but that's okay. It's anticipated. The fact that it's only 5% with COVID with Moderna and Pfizer is amazing. Again, if the J&J vaccine is 75%, that's still really good. That's basically better than the flu shot. So yeah, people are still going to get sick. That's okay. What we want to do is prevent the hospitalizations and the deaths and the serious complications.
Okay, and that is, I think we touched on everything. So that is it for the questions. I don't know, Allie, if you want to close us out.
Ali asked me to. This is Jane. Thank you. That's okay. I want to thank everybody. First of all, I want to thank our panelists today. You guys were great, Marc and Mike. You're always full of knowledge and advice and good information for our employers, and we really appreciate that. And Dr. Mintz, it was great to hear from you on some of the information that can hopefully make people be less reluctant to get the vaccine, because I think we all want to get out of this and be safe and not have to worry about all these questions that we discussed today. But we're happy to have you guys here. We really appreciate your expertise and your support of all of our chambers. And so on behalf of Ali from the Greater Bethesda Chamber and my colleague Marilyn from the Gaithersburg-Germantown